Perfect. So, this is our last one of the year. I can't believe here we are in December and getting ready for 2026. So, what I would like to do first is we're going to go around the Zoom and I'll just go based on my screen and call on people to introduce yourselves. If you will, please let us know your name, what organization you're representing, and what your military affiliation, if you have one, what that is. So, Landry, would you like to start us off?
Yeah, sure. Hi, everyone. My name is Landry Young. I'm the marketing outreach manager at the Joel Fund. My military connection is my husband. So we are stationed at Fort Bragg, where we did not get any snow yesterday. And yeah, we're not doing a poll question today, right?
No. No.
Okay.
Okay. Severica?
Hi everyone, my name is Saverika and I serve as the manager of services at the support network for servicewomen, moral injury support for servicewomen. I'm grateful for the opportunity to be here with you all.
Thank you. Appreciate you joining us. Brenda?
Hi, I'm Britta Brubaker, and something just went off there, so excuse the background noise. United States Navy Nurse Corps from 71 to 76. I represent Vietnam Veterans of America.
Thank you. Yokasta?
Hi, everyone. My name is Yokasta Crouse, and I work for Blue Cross and Blue Shield of North Carolina. I am their military SME, and my military affiliation is through family and friends.
Thank you. Paige?
I am Paige Crafton. I am retired Air Force, 26 years, and I now work at NC Works in Durham and help veterans with significant barriers to employment and work with employers to educate them while they should have that.
Thank you, Paige. Adam?
Adam Swift with Safe Project. We're a national nonprofit that aims to stop the addiction fatality epidemic. And I am a 26-year Air Force veteran as well. And I direct Safe Project's veteran portfolio. So glad to be here.
Thank you for joining us. Yesenia?
Hi everyone, I'm representing Higher Heroes USA, military affiliation, myself, 24 years Marine Corps, but also a mother, gosh, sister-in-law, big military family.
Yes, thank you. Kristy?
Hi everyone, Kristy Andrews. I am the Director of Development for HBOT for Heroes, and we are a nonprofit here, right here in the Raleigh-Durham area. So we pay for hyperbaric oxygen therapy for our veterans, and my military affiliation is really through my dad. So he was Vietnam as well, and I saw the amazing results he had going through this program, and just life-changing.
Landry and I recently had a tour of their facility and it's incredible. So excited to have you. Thank you, Kristy.
Thank you.
Isabella?
Hi, I'm Isabella Brzezinski. I'm the Operation Art Program Manager here at the Joel Fund, managing all things art classes and workshops for military veterans and their family members. My dad is an Army veteran, so that's my military connection. Oh, we're not doing a question. I was like, what's the
I know, I had the same thing.
That's you're keeping us on our toes. It's good.
What we should have said is who are you cheering for in the Army Navy game? But I know your answer.
Oh, yeah. They both should win.
Aw, look at that.
Everyone just wants to have fun.
Thank you. Cynthia?
Hi, I'm Cynthia Harris, and I'm the lead caseworker with USA Veterans Help. We're transitional housing for homeless veterans, and I think we do a pretty good job of helping them to get into permanent housing. My military connection is my husband, who is a former Marine. Thank you.
Thank you. I love your Christmas outfit.
Thank you. Every day until the 25th.
It's awesome. I love
Something
that.
different. All right.
Jessica? Oh, I can't hear you. Jessica, we can't hear you.
Your mic isn't working, Jessica.
No.
How about now?
Yes.
Yes.
Perfect. It's been a minute since I've been on Zoom. I am Jessica Miles. I am the group consultant for Blue Cross Federal Employee Program. And so my affiliation is with all of the wonderful members that I get to interface with who are now friends at Cherry Point, which is the military base that I service.
Very cool. Thank you for joining us. Terry?
Hi, everyone. I'm Terry Aaron. I'm with Division of Workforce Solutions, Veterans Employment Services. I'm a Marine Corps veteran.
Thank you. Michelle?
Hi, I'm Michelle Hainsworth. I'm also with Veterans Employment Services, and I am also a Marine Corps veteran.
I love it. Thank you. Allie?
Hi everyone. Sorry I'm late. I was picking up my kid from school. I'm Allie Anderson. I'm the community care manager here at the Joel Fund, and I'm an Army spouse.
Thank you. Brianne?
Hi, I'm Brianne Lyda McDonald. I'm a project director at the North Carolina Institute of Medicine, and I'm a daughter, granddaughter, and sister-in-law of Air Force veterans.
Awesome. Thank you. Randy?
Good afternoon, everyone. I'm Randy Silver with NC Works Veteran Services. I am a Army retiree, Army veteran, and of course, Army is going to beat Navy. Sorry.
Ooh. Ooh. Randy, I'm going to text you. I'm going to the game, so I'm going to text you a picture of that scoreboard at the end.
I love it. Stir the pot.
No worries.
Thanks, Randy. Carla?
Good afternoon. I'm Carla Jackson. I am the Veteran Services Supervisor over at Wake County Veteran Services, and I am a Navy veteran, and Navy is going to win.
I love it. I love it. Did I miss anyone? No. Before Landry jumps into our panel discussion, I want to give a quick shout out to Blue Cross Blue Shield of North Carolina. They are going to be our VMFA sponsor next year, and we're really excited that they're joining us. And just want to just say how much we appreciate everything they do for us and for our veteran community. So next year is going to be our VMFA meetings are going to be just even that more fabulous. So thank you. Landry, all yours.
All righty. So our discussion today is on health and healthcare. And today we have some really neat panelists. So first and foremost, Blue Cross Blue Shield is here to represent what they do. We have Yokasta Crouse and Jessica Miles. From HBOT for Heroes, we have Kristy Andrews. And from the SAFE Project Veterans Initiative, we have Adam Swift. So I know we just did introductions, but we're going to go through each one of those and let them kind of introduce more of what they do at their organization and how they serve veterans. So I will start with the Blue Cross North Carolina team.
I'll let Jessica go first.
I was gonna say, Yokasta, you can go. Well, again, I'm Jessica Miles, and I'm a dedicated group consultant for the Federal Employee Program. So what that means is that I have the privilege to sell and educate to our federal members, which of course is inclusive of the military. And as I mentioned before, we have certain territories, and so one of my military bases is Cherry Point and Havelock. And I also service the National Guard. So what that means is that for those who are eligible, I talk with them about their different medical benefits that are available to them through Blue Cross. And for all military, I also talk about dental and vision because many times the military is not aware that they are eligible for those benefits. So I love going around and educating about that and talking about those ancillary benefits for our service men and women. Yokasta? What do
Awesome.
you
Thank
do,
you.
Yokasta?
What do I do? I don't do nothing. So my name is Yokasta Crouse, and what I do as the military SME for Blue Cross and Blue Shield is we focus, first of all, Blue Cross and Blue Shield, for folks that may not be aware, we are not for profit. Our headquarters is in Durham, North Carolina. So Jessica and myself, we're both based here in the Triangle, and we do a lot of things within the military world. We are partners with 40 different national organizations where Blue Run to Remember, the Armed Services YMCA, the Joel Fund, for example, the USO, and the list goes on and on. What that means is we focus on the drivers of health of the military and veteran community. For our active duty military families, we recognize unemployment rates are higher. So with that, we became military spouse employment partners. We're also a part of DoD Skill Bridge. We have a veteran employee network group for our service members and for those military supporters that work within our workforce. We do several volunteer activities throughout the entire state. And we do other things when we're out in the field. We listen to the stories and the challenges that the community is facing, whether it's access to care, maternal health, food insecurity, or things. When we talk about access to care, for example, we know that military families are not able to bring their children with them for medical appointments. So we partnered with the ASYMCA to provide free childcare for all active duty military families and veterans. And they just register with them and they can be seen at Womack or the Cohen Center. And it's a lot of things, but that's what I focus on, is trying to find that intersectionality between all of our divisions and how we can be of better support to the uniformed services community here in the state. Thank you.
Wonderful. Thank you. All right, now we'll pass it over to Kristy to introduce what she does with HBOT for Heroes.
Thank you. So HBOT for Heroes is a nonprofit. We do use a clinic right here in the Raleigh-Durham area that is called Extivita. And what we do is we fund hyperbaric oxygen therapy. So in 2019, North Carolina passed House Bill 50, which authorized the use of hyperbaric oxygen therapy for our veterans with PTSD and TBI. From 2021 to 2024, the state of North Carolina was funding this program. They did provide us with $1.25 million to treat our veterans. Over the past year, because state of North Carolina still does not have a budget, over the past year, we have been working solely off donations, grants, sponsorships, and things like that. So some really exciting news is that recently we have funded 10,000 dives. We call them dives in the industry. Those are treatments. Thank you. It is very exciting. 10,000 treatments we have been able to fund for our veterans across North Carolina. That is 330 veterans that we have been able to help treat and save their life, really. Our big mission here is suicide prevention. And so hyperbaric oxygen therapy gives the body what it needs so that the brain can actually heal. So it's a simple combination of oxygen and pressure. Is completely non-invasive. And, when I talk about hyperbarics, like a lot of people, just a few years ago, they didn't know anything about it. At this point, probably most of you have heard about hyperbaric oxygen therapy and what it's doing for our veterans. So that's what we're doing here. Insurance does not pay for this for PTSD and TBI because it is not cleared by the FDA for those indications. So without a nonprofit like HBOT for Heroes, they would not have access to this therapy. And we do have a 57% efficacy rate in reducing or eliminating suicidal ideations. So there is so much about hyperbaric oxygen therapy. We talked Brooke and Landry's ear off just last week. They came, they toured the clinic. And, we all have so much passion for what we do because we do see it day in and day out, the lives that are being changed and being saved with something just so very, very simple. So I can obviously, answer any questions as we kind of go on, but that's essentially the gist of who we are and what we do.
That is awesome. I'm actually dropping a photo in the chat right now from when we were just there last week.
Yeah.
We had so much fun. Hopefully y'all are able to see that. We had so much fun touring the facility and getting to learn more about what they do. Uh, we were just blown away by the work. And I think I talked my husband's ear off. Oh, I'm sorry. I took it on my iPhone, so sometimes iPhone photos don't work unless you're on a Mac.
Oh, yeah. I was having
I'm
a problem
sorry.
with that too. But essentially the chambers are massive. So you really got a good feel for the camaraderie. I think that that occurs in those chambers. We could put 12 veterans in there at once. And so they really do, they make lifelong friends while they heal.
Yeah, that's amazing. Thank you, Kristy. All right, now we will let Adam introduce what he does with Safe Project. Allie and I got to meet Adam over email. Was that last week or the week before? It was very soon, but we've just found so many ways that we can kind of collaborate, and we're looking forward to a long partnership. And so I'm super excited to have Adam here today.
Yeah, I'm super excited to be here as well. Landry knows I logged on at 12 o'clock in anticipation. It's got my times mixed up. But I'm the director of Safe Veterans at Safe Project, as I said, and we focus on preventing overdoses, supporting recovery, and strengthening community-based wellness. We have at Safe Project 4 initiatives. We're in communities, safe communities. And so we're in churches and schools and organizations. We're safe workplaces where we go into businesses, whether that's Home Depot, Walmart, the construction industry, safe campuses, which are colleges and universities, doing great work there. And then I manage our Safe Veterans Initiative. And Safe Veteran is specifically designed for SMVFs, which we call service members, veterans, and families, and other military connected members. And we focus on, again, prevention, connection, and mental wellness. Um, our flagship program within the Veteran Initiatives is our Military Wellness Workshop. It's an evidence-based, peer-led, one-day experience that was built for and by veterans, designed exactly to do that, prevention, connection, and mental wellness. Um, Within Safe Veterans and Safe Project, we partner with colleges, veteran services organizations, employers, criminal justice settings, community, everybody. We'll partner with just about everybody who's helping veterans and has an aligned vision to help bring accessible stigma reducing programs directly into local communities. And so, in my role as the director is to focus on program delivery, facilitator development, institutional partnerships, expansions, and align our work with public health and community needs. And so, that's us in a nutshell.
Awesome. Thank you.
Mhm.
Alrighty, so now we'll swing back around to Blue Cross Blue Shield. My next question is, could you give an kind of overall of who all you serve? Because I know you have so many different programs. Oh yes, there's a picture. Thanks, Kristy. But could y'all kind of explain who all you serve, including veterans, reservists, guard, family members, caregivers within your different programs for a military community?
Everybody that you just said, Landry. So
Yeah.
everybody. So from my perspective, as a consultant, and it's not just me, there are 4 of us, and we serve the entire 100 counties across the state of North Carolina. So any federal or military agency or installation, we are there and we are trying to get there. And one of the first things I will say is that if you know of folks or have connections with anyone with the military installations or organizations, please let them know that we are out there, because we are always trying to find opportunities just like this to be able to let folks know exactly what is available to them. So we are always, always, always willing to come and talk about what's available to our potential members and to our current members. And so, as I said before, whether it's a military installation that we are going to, I also serve with, again, the National Guard, supporting them. I like to try to find spouses, organizations, especially on the military bases, because a lot of times it's the spouses that are driving the decisions in the household. So we want to be able to talk with them. Um, and what was the second part to your question? You said, who do we serve? And what was the second part? I want to make sure I answer thoroughly.
Yeah, you got it. You're on it. Um, yeah, that is great to know. And for those that are new, after this meeting, I'll send out a follow-up email and I'll include everyone's contact information. So I know a lot of people in here might have like resource fairs or other events where you are looking for partners to support. And so it's great to know, Jessica, that you are ready to be out there supporting those
Oh
events.
yeah. And so let me just say this, my target audience, to your point, is everybody. So I just want to, if I didn't stress that enough, I just want to stress that, um, that it is, because again, it's just so vitally important that our military community know what's available to them. And I think we all know that sometimes that can be a challenge for various reasons. And so, again, to let them know that they have dental and vision available for their dependents and spouses, I think a lot of times, 9 times out of 10, many times they're very surprised to know that that is available to them.
Awesome. Thank you. Yokasta, did you want to add anything?
I think Jessica covered most of it in regards to the different partnerships that we have through nonprofits, as well as like employment opportunities. It's pretty much a catch-all. Obviously, for obvious reasons, MSIP is for military spouses. We do try to target those individuals through that program. DoD is those transitioning out of military service. But in regards to veteran recruitment, that's for anybody, no matter what branch of service they are currently in or have been a part of. And in specifics to certain services, what I mentioned earlier with like access to care at Fort Bragg, that is specific to the Fort Bragg area. Although any veteran, let's say your Navy or anything else, could get those services through the Armed Services Wednesday. Unfortunately, they don't have one. We are working hopefully to expand that to Camp Lejeune in the near future. So it's all in the works, but there are different access programs. Like if, for example, we have a Fayetteville Retail Center, one in Greenville, one in Raleigh, as well in Charlotte. And we're doing different activities that the community is more than welcome to attend. You do not have to be a veteran or anything. I mean, you don't even have to be a Blue Cross member. We do bingo for the community. We do healthy cooking classes, several activities, and hopefully the Joel Fund will have them out there in the near future. So that is open to anyone and everyone is welcomed.
And we added yoga.
No, that's awesome. That's so fun. Okay, thank you. All right, Kristy, same question over to you. Could you kind of give an overview of who all is eligible to receive your services underneath the HBOT for Heroes nonprofit umbrella?
Yeah, so we were really limited to veterans for quite a while because that is what the state funding covered was veterans. So this last year has been really interesting because since we were not operating under state funding, we opened it up to so many more. And so Active has been really exciting to treat because we're now collecting data for injuries more in the acute stage, which is amazing because they may not need the full 40 treatments. So if in fact you can get into the hyperbaric chamber during a head injury, that's in that acute stage, sometimes we only need a handful of treatments. That's a huge cost savings as well, and also allows that veteran, that active military member, to just be better everything that they're doing. We're healing the brain and we're doing it quickly. So that's very exciting because the clinic that we work with, Ex Vita, they're also going to be opening up a clinic in Jacksonville next year. So that's going to put us closer to Camp Lejeune and be able to kind of tap into that active military a little bit more. So at this point, really, we're focusing on anybody who could use our services within the active or veteran community, the military community, with head injuries. This is really kind of where our focus is because this is one of the indications that is not covered by insurance. So PTSD and TBI. And then, of course, too, moving in 2026, we are also looking to tap into how, in the best ways to get funding to treat first responders. And so there's a lot of crossover there too. A lot of our first responders are veterans, active military. Not necessarily active, but veterans for the most part, or maybe in the reserves. But this is, really exciting for us because we get a chance to really kind of tap into all of our heroes who need us and need another way to heal and to need an option. Options are good. You got nothing to lose, everything to gain.
That's awesome. And for those that might not fall under the HBOT umbrella, that still want to receive services, they can still access that, correct?
Through as far as for hyperbaric oxygen therapy.
Yes.
Yeah. So even if you're not veteran, active military, first responder. I mean, even if you're just a civilian, it's open to everybody for hyperbaric oxygen therapy. So the clinic that we use, Ex Vita, they treat in a typical session. They're going to treat veterans. They're going to treat civilians. All of that would be happening in one dive session. So it's really exciting because here we're the nonprofit, kind of behind everything. So we're the ones that are paying for those veterans, those active military, to get those treatments. And it does cost us, and this is a negotiated rate, about $6,000 to put one veteran through all 40 treatments. So that's why I really stress that active military and being able to let people know that this is available to them during that acute stage of a head injury. Because again, I mean, it's a huge cost savings for everybody. If we can get them in there and, it's costing us maybe $500, $600. You know what I mean? $150 per treatment. Sometimes you really only need like 3 or 4, depending on when the concussion happened and everything else. It's really there's so much science to it, and it's just exciting. It's fascinating.
Yeah. Okay, that is great to know. Thank you. All right, Adam, and question over to you. Could you kind of explain who all is you serve through the Safe Project Veterans Initiative? Is it veterans, family members, guard, reservists?
Yeah, when I'm asked this question, I generally give the tagline, "We don't turn anyone away," and so we do target that SMVF acronym I used before, service members, veterans, and families, with our programs. But again, our nonprofit reaches beyond veterans. But as far as our veterans initiative, yeah, we are a primary prevention, and we do focus on wellness. And so our offerings are really designed to benefit the entire ecosystem of the veteran, right? So everybody who that veteran is connected to. We hear that term military connected, as far as when talking about what benefits are available to whom. And we like to allow the individual to define what military connected means. And so we don't use a whole lot of restrictive definitions in that regard. And so we really aim to serve everyone. And our workshop is designed in such a way that anyone could benefit. We also have, in 2026, we're looking to go into first responders and law enforcement. We're targeting returning citizens, so justice involved folks who are coming back to their communities. And so we're expanding in those areas, and we're starting with the veteran populations within those areas. And so we're really proud of the work that we're doing in that regard. So.
Awesome. Thank you. All right, y'all. My next question over to the Blue Cross NC team. What is the protocol? How do people access your services?
So the process to be able to obtain dental and vision coverage, and what I always am making sure that our military folks understand, is everything goes through what is called FedVIP, FEDVIP. That's the Federal Dental and Vision Insurance Program, Federal Employee Dental and Vision Insurance Program. And so everything runs through that. And benefits is kind of the umbrella that manages all of that. If you've ever heard of benefits. And so what my role is just to, again, to educate them, to let them know and understand exactly what the process is so that they can get those resources. And what I am learning too, as I'm working more with the military community, is that there are a lot of gray areas when it comes to eligibility. So benefits does that for us, and they will, when a person calls, then they will determine their eligibility, whether they're eligible or not. They'll get them set up with an account, and then the individual can go and make their elections. So it's a very simple process. They don't have to try to figure it out on their own. They can do it online or they can call an 800 number that we have either way. So we try to make it as easy and as seamless as possible. And these are benefits that they can take into retirement as well. So some benefits are available to them when they're active and then others when they're retired. So again, just making sure that they know what those resources are. Yokasta, anything you would add to that as far as the process that we have?
Not in regards to our benefits. Thank you so much for giving such a comprehensive view of that. I love Jessica's precise details. It's amazing. In regards to our nonprofit partners, I did list some of them in the chat. I know it's a very extensive list. While we do not directly clearly we work through the USO, for example, we'll be at Project Exodus next week at the Charlotte Airport, passing out snacks to our service members going home for the holidays. This is how you're able to access these programs, is by going to these nonprofit partners and receiving the services through that partnership. In regards to employment, I did give a hyperlink to our career site where you can learn more about our employee network, as well as employment opportunities and what we have in place at Blue Cross. So it's just in various different ways. It all depends on exactly what you're trying to access. Thank you.
Okay, that's great. Thank you. All right, Kristy, what's the protocol for somebody to get your services at HBOT?
So if you go to our website, is HBOT, HBOT, forheroes.org, and that's the number 4. Really everything starts there. So we have a few different ways that people can access our services. So they can nominate somebody. We get a lot of nominations in. Or the veteran or active military service member can go on there and basically you go to get treatment. And when you're on that Get Treatment page, you just fill out a quick intake form and then we have an application. We really don't have a lot of really strict, let me put it this way, there are a lot of organizations across the United States that does what we do, that funds hyperbaric oxygen therapy. Nobody is funding it to the extent that we are in North Carolina. And one of the things that really sets us apart is that you do not necessarily have to have a combat-related injury. And so a lot of the organizations out there, it needs to be an injury related to combat. The way we see it, you served our country with honor, and we will treat you. They don't have another option to get it without us. So that's really the two main ways that they can access treatment. Right now, though, we do have a wait list that is extremely extensive. So once they complete that intake form, they send their application in, their DD-214, and their ID. That goes to a veteran treatment coordinator at the clinic. The wait list right now is about 100 veterans deep. So that is, I think that speaks volume of the program. Every time I look at it, it remains over 100. And they're continuing to move our veterans through at a pretty rapid rate. And veteran does have up to 4 months to complete the program. So there is a time schedule, there as well. But we are telling people it's probably between 6 to 8 months right now to access services. Our wait list right now is a funding wait list, though. It is not a capacity wait list. So it's about 6 to 8 months to get to the top of the wait list. process for us to find funding to be able to treat you. So that's really important to know, that if a veteran this is something that they think they want to take advantage of. There are a lot of organizations out there, even their American Legion. We've seen that. There are a lot of organizations out there that are stepping up to say, I will pay the $6,000 for you to get this treatment. So kind of keep that in mind if you ever hear of anybody who's interested in this. If they can come with a funding source, then there is no wait list. We can move them through very, very quickly, because we don't have to go chase funding for them. But yeah, that's pretty much is a very simple process. They apply, we approve, and then we just kind of figure out what makes the most sense, on how to get them in treatment as quickly as we can. So it's going to be very exciting when the clinic does open up in Jacksonville next year. There's our heads are spinning around here. There's so much going on. It's very exciting. We're making such a huge difference, and it can be a little overwhelming, but we walk the path God's put us to help all these veterans.
That's wonderful. I want to kind of touch on the nomination process. We hear all the time that veterans are hesitant to reach out for services for themselves, or they think that, there's other people out there that need it more than them. So how does the nomination process work? Does like a family member nominate them and then y'all reach out to the veteran?
Yeah, so during the nomination process, we see it come in as family members, friends. They ask the question on there is, can we reach out directly to them, or would you like us to reach out to you? So our veteran treatment coordinator looks at all of those, and then she will intervene at that point. She will contact however they want to be contacted. Because you're very right, and we hear it all the time, is that somebody else needs it more than I do, and so I'm not going to take advantage of the program because there's somebody else out there who might be suicidal and they need the funding, especially if you're trying to find funding, for me. So that's kind of a big thing that we hear, often. So we do encourage, if you know somebody who could benefit from this. I mentioned the suicidal part of this because there is no wait list if they come to us and they mark a yes on that question that says, have you had suicidal ideations in the past 60 days? There is no wait. There is no funding wait. There is no capacity wait. Our veteran treatment coordinator moves them straight to the top, and assessments start happening, and magic starts happening to get them in very quickly. So we've had a lot of success. We have organizations that we can tap into very quickly to help fund that. So just kind of keep that in mind. That's really important to us.
Okay, great. Thank you for explaining that more.
Thank you.
Okay. And Adam, what's the protocol for somebody to receive your services?
Yeah, so our services are community-based and open access. And so primarily we partner with an organization, a local organization, and they bring the program to the local city or town or to their organization. And that's how most folks will find out about our workshops. Say we advertise with the organization, the host organization. It's on our website. I'll put in the chat there a link to our module 1 online. It's an introduction to our workshop. And so some folks will see this and go through the introduction to the workshop and want to be a part of it from that way. And so for us, there's no diagnosis, no insurance, no referral needed. And it's low barrier, intentionally low barrier, and prevention oriented. And so we are really trying to work with local partners. As a national nonprofit, sometimes it's a little bit more difficult to get into the local area. But we're working hard to get into local areas to build those partnerships, build those relationships, and bring the workshop to the organizations. We're with there in Raleigh. We're working to bring it to Campbell University in the Raleigh area next year. And so that's one way we'll be in the local area, but happy to bring it to any organization that way.
Okay, great. If anybody's interested in having hosting a workshop, do they just reach out directly to you?
Yes, you can reach out directly to me, and we can have that discussion about what partnership looks like, and take it from there. So it's again, it's low barrier for both the host and for our SMVFs who want to attend the workshop. So
Okay, great to know. Thank you.
yeah.
All right, guys, this kind of brings me to our last kind of collaborative question, and I encourage participation from anybody else that is attending. This is kind of where we see a lot of connections made. So I'll start with the Blue Cross North Carolina team. What are some of the gaps and struggles that y'all are seeing right now, and how can we work together to minimize those?
Invite me to your spouse's club. Um, no, in all seriousness, I think it is probably what many of us have a challenge with is just getting the word out, just letting people know that we are a resource. And one of the things that I love about working for Blue Cross and being able to provide such rich plans and benefits is the fact that we are with you throughout the whole process. So it's not a situation where, someone gets a plan and then that's it. They always have us as a resource. They always have someone that they can look at eyeball to eyeball if they need to understand the benefits that they have or to help them make decisions about the benefits that they have. And so, really, that's what we yearn for so much is to be able to find those opportunities, find those audiences that need to know that this is available so that we can educate them on that and reiterate the fact that we're going to be with them every step of the way.
I was going
Yeah,
to
that's
say that
awesome.
it is our biggest challenge is just trying to bring the awareness of what we offer as far as services. And even as much as we have mentioned on this short phone call, there's some things I never even got into, which, Jessica has hands-on experiences. We do provide services in the field. When we talk about being in the field, Jessica and our healthcare consultant and our caseworkers will go out into the field and provide free vision screenings or free hearing screenings, blood pressure checks, and body. We do a lot of wellness opportunities in the field for the community at no cost to them. So it is knowing about those, opportunities that arise. I know I've run into Brick and Landry, matter of fact, out in the field where we've done some of these services, but it is about just being aware of when these activities are coming up. Obviously, we have a very small but mighty team, and so we want to make sure that they have as much advance notice as possible so that we have the opportunity to get out there and provide those services at no cost. But yes, it's a wide range of things that we offer. So I think that's our biggest challenge is trying to get that all in a beautiful brochure, I wish, where I can say we do X, Y, Z. But just having meaningful conversations and community connections is very beneficial to us.
Yeah.
Right.
And let me just say this too. I think sometimes when people see sales consultant or whatever, they she's coming, she's gonna try to sell me something. That's really not not the situation. I cannot reiterate enough. It really is about education because they really only can make changes once a year. So, all year long, it really is about us educating. So, again, if you all know of someone or a particular organization that's what it's all about, and that is our mission, because we are a mission driven company, and that is our purpose in that space. So
Awesome. So who would be best to reach out to if somebody here was hosting an event and they wanted to invite y'all out to present or have screenings available? Who would be the best to reach out to?
she's to the right of me on the screen, so I'm trying to showcase Yokasta. Is what I'm trying to do.
Okay.
But I think Yokasta would be the best contact person because she's involved enterprise wide as it relates to military support, so she would be able to funnel it to the appropriate person or resource internally.
Okay. You costing your email might blow up soon.
I was gonna say she didn't say anything, so I'm
Oh,
assuming that's
perfect.
okay
Yes.
with her.
No, I'm
Thank you
I'm
for dropping.
absolutely perfect with that. And that way, and I did say we're a small mighty team, so if there's other resources, if you guys are trying to get in contact with our TA team, I can make those connections for you as well.
Yeah.
Happy to do
That
so.
is great to know. Thank you,
Very
guys.
resourceful.
All right, over to you, Kristy. What are some of the gaps and struggles that you're seeing that we can kind of work together?
Oh, how the tables have turned for us here at HBOT for Heroes. We are a nonprofit that was established from state funding. And so when that state funding stopped, our challenge is funding. I mean, that is our biggest challenge. If you asked me this question a year or two ago, our challenge would be awareness and letting veterans know about it, that this is available to them. And we have done a fantastic job of that. Our wait list shows that. We don't, I wouldn't say we don't need veterans. We need veterans. I mean, we need them to know about it. At this point, but we need the funding because it's exhausting, looking at the wait list and just continuing to see it just never ends. It never ends. They know about it. This is working. They're telling everybody about it. We want to help everybody. We want to give this to everybody. When the Jacksonville Clinic opens up, we want to line out the door of veterans who need this, and we can only do that with funding. So we're going after. North Carolina did not pass a state budget yet, and so we have a lot of people working on this to get us some state money. But beyond that, we need help identifying the veteran organizations that are out there that do pay for treatment, that would step up. And we have we're being very successful in the special operations side of things. A lot of special ops organizations are stepping up, but they're of course only paying for special ops, which we have identified. But what about everybody else? And so these are the ones that we're struggling with. The Vietnam veterans, that still they need this. I mean, we are seeing it. I saw it with my dad. I witnessed it over and over and over again. I mean, some of these Vietnam veterans come through this program and say, I didn't realize that I'd been living with PTSD my whole life until it was gone, until it's finally gone. So that's where we need help. We need help finding these organizations that will step up and pay that $6,000 and sponsor some of these veterans to go through this. Because some of them don't have 8 months, to wait for us to find funding. So that's where we're at. Funding. We are getting a huge dose of the real nonprofit life over here at HBOT for Heroes, trying to find all the things. Or grants, if you know of grants that could help. I write all of our grants too. Send them my way. It takes all of us to just kind of know what's out there.
Yeah. So speaking of funding, I was looking on your website earlier and I saw that y'all are doing a silent auction right now.
We are. We have a few fundraisers going on. The silent auction actually ends at the end of the month, or actually at the end of the week. So you can go online there. It's all donated through just things that our ambassadors have come up with. A lot of it is like Amazon products that have been donated to us. We are literally trying to find every and any way that we can raise money. Now, one of our most exciting fundraisers, I think, going on right now too, is called Cheers for 10,000. And so our Cheers for 10,000 fundraiser is a celebration of the 10,000 dives that we're funding. And Buffalo Trace has chosen us as one of their top 100 nonprofits in the United States to donate a bourbon set that is rare. It's the charity bourbon set worth about $2,500. So we have that going on now too. You can go into events on our website. We literally just push this out. That'll go through the whole month. But at $6,000 a veteran, I mean, it's like we work so hard to raise every dollar, and it goes so fast. So we're doing all the things. We are only 2 people here. That's it. We are 2 people that's on staff. Everybody else is volunteers, ambassadors. We literally do it all, including searching for funding. So support for the fundraisers we have going on. Thank you for mentioning that, Landry.
Yeah, for
There's some
sure.
really cool things that we have going on right now. And just if you know anybody who can help, sponsor some veterans, that's what we need.
Yeah, that's awesome. I was browsing earlier. There are some really good potential Christmas gifts on that silent
Yes,
auction.
yes. Everything in there in that silent auction, most of it is like 50% off, but nobody bid on my bread maker. That is mine.
I was actually thinking about bidding on the bread maker. Didn't know that
There's
was
a
you.
bread maker on there that I was like, that's a Christmas gift for my husband.
Yeah, because I need one.
You can bid on it, but I'll probably try to outbid you. But there's some
Okay.
really great stuff on there. Most of it is about 50% off of what you would pay for it right now on Amazon. I mean, so you're helping a nonprofit, getting some good gifts. And I mean, that is like literally a team of us staying up till like midnight on nights putting these baskets together. So I do appreciate you mentioning that. So we got some cool stuff going on.
Kristy, real quick, I just wanted to mention, I just sent you an email. We get these, and for everyone else in the group who applies for grants, we get these emails from the Blue Cross North Carolina Foundation. It's called Grant Funding Focus. I don't know if you receive them, but it is a lengthy document filled with great grant opportunities. So
Okay.
I forwarded it to you. If anyone else would like it, let me know. I can send it over to you. But it's a way that they help out nonprofits. You know, they do this kind of research, put together this whole huge document. So I just sent it over to you.
Oh, I love that. Thank you. I see it here. Okay, perfect. I'll dig in. Thank you. Thank you.
Sure.
Bam. And that's what we're doing today. We're making connections.
That's
I love
right.
it. All right. Thank you, Kristy. And now, Adam, last but not least, let's discuss some of the gaps and struggles that you're seeing over on your end.
Yeah, I could say ditto to a lot of the things that have already been said. And but specifically for us is that I'm really big goals for this coming year are developing those partnerships and those relationships with local community organizations. And then within our military wellness workshop, we have two programs that extend from that. A facilitator program where local organizations can we can train members of your organization to facilitate the workshop. And then an ambassador program. Some folks don't want to be in front of a classroom facilitating a workshop. Our ambassador program trains folks to take the journey one-on-one with individuals. And so, yeah, that I think that would be the space that I would say that's where we can work together most. I think our veterans are facing kind of I would call it a fragmented access to care. And so don't know really a lot about what community-based wellness resources are available to them beyond the VA, and then the VA may have the stigma of the VA attached to it. And so bringing the workshop to the local space is really where we're looking at growing and developing the program this year.
Okay, that's great. And it's perfect for everyone on this call to know that too. Do you have like like a document about the workshops that you could share with me that I could send out?
I do. I certainly do. And I'll send an email with information about the workshop and then attach a few flyers. And I'll include the link to module one there as well.
Awesome. Yeah, let's get that spread out all over to the group. It's awesome.
Yeah.
Does anybody have anything else they want to add to this conversation before we go into group updates? Yeah. Okay. I feel like that hour went by really fast. So we're gonna do some group updates around the room. If you have upcoming events or news or anything else that you want to share, now's the time.
I'll kick us off. Operation Art spring session, which will start the week of January 12th in 2026. The registration for those classes is now open. We opened yesterday, and some classes are already full. So if you're interested in taking a class yourself or sharing it with the veterans you work with, we have virtual classes, and then our in-person classes will be in Northern Wake County, hopefully in our Rollsville area. And we also have Deploy Operation Art, where we are partnering with community art organizations throughout the Greater Triangle area to offer free workshops, art workshops for veterans and their family members in those locations. And we have two coming up in December. One in the Oxford Library in partnership with Granville Veteran Services on December 13th in the morning. And we have one in partnership with Durham Whole Health at the National Guard Armory in Durham on December 16th. So I will, if you have any questions, let me know. I will also be at Recon this Saturday if you want to talk to me in person and you're able to stop by.
Awesome. I see Carla has an event, but real quick, I want to touch on Yesenia's question in the chat. How does she connect a veteran that currently does not have medical insurance to Blue Cross Blue Shield to provide the veteran some options and guidance?
We would just need to know where that veteran is located and we can connect them with the appropriate consultant. We just need to know what county that veteran's located in.
So he lives in Johnston County. He went to the VA in Durham and was denied because they said he made too much money, so he could not get medical care through the VA because of that. He does have his duty 214. So basically right now he's without insurance.
Okay. So so if he lives in Johnston County, that would be me. So I can put my contact information in the chat and he can reach out because he's a veteran, and I would just need to make sure to see whether or not he would have federal benefits as a federal employee, which most of the times they do not, but they can do the dental and vision. But nevertheless, I can connect him with someone in the individual market that can help him with what his options would be.
Thank you.
Mm-hmm.
Awesome. All right, Carla, do you want to tell us about your event?
Okay, so I know this has been a long time coming, but Wake County is doing a stand down in 2026.
Woo!
It will happen at the end of May to the beginning of June. Next week, we are touring our potential spot. We would love some participation in this stand down. So if you are interested in participating, please let me or Siobhan Norris know. I will put our information in the chat. And we look forward to community partners participating with us.
Awesome. Yeah, sign us up. Thanks, Allie. Are you going, Allie?
We will.
I'll be back by then. Don't worry.
Okay. Cool. All right. Casa shared an event. Do you want to tell us about that?
So we're participating in several different events over the next 2 weeks. For example, the North Carolina National Guard Tar Heel Retiree Homecoming is this Friday at Joint Force Headquarters in Raleigh. We'll be out there the following day, Saturday the 13th. We're going to be at the Coast Guard Station Elizabeth City for their Coastie Christmas Jubilee. It's a tongue twister. And next week we are partnering with Keys 365 and we're doing a suicide prevention class at our Fayetteville retail location, which is right across from the hospital in the Bordeaux Shopping Center. It's open to the public, so we just ask that you register so that we can accommodate for enough seating for everyone. And then, of course, we'll be at the USO Charlotte Airport for Project Exodus, welcoming our service members home or wishing them great travels home for the holidays. And that's just within the next 2 weeks. So we have a lot of activities going on. So just let me know if you're interested in anything. Thank you.
Awesome. Thank you for sharing that. Do we have any other updates? I know we're a little past 2 now, but.
Landry, do you want to talk about Recon?
Yeah, Isabella mentioned it, but we are hosting another Recon session this Saturday. The focus will be on social enrichment, which is perfect in times for holidays and prioritizing mental health and connections So we'll be meeting at the Wake County Northern Regional Center, which is about 2 minutes from our current office in Wake Forest. We're going to have some really awesome people there. Isabel will be there sharing Operation Art. We'll have Helping Horse. We'll have Drum for Change, Conduit for Change. My husband will be there representing Team RWB. He was voluntold. And we're going to have I coach and teach boxing. So it's a really fun group, and we'll have a great and fun conversation there. It'll be starting at 8:30 a.m. and we'll be out of there by 10. So we'd love to have you all there. It is in person only, and I will share the information in our email. But that's all I got. Last call. Alrighty, thank you everybody for joining us today, and thank you for being flexible for us pivoting to virtual while those that are northern of where I am enjoy their inch or so of snow. Thank you to our amazing panelists, and thank you to Blue Cross Blue Shield for being our sponsor in 2026. We're super excited to partner with y'all on this and keep bringing awesome resources to the VMFA. Also, yeah, our coffee connection's coming up next week. This is the last one in our space in the office. So yeah, super sweet. And next in January, we'll be at the Joel Center. We believe.
Thanks, everyone.
Yep. Thanks, everybody.
Happy holidays.
Thank you.
Thanks.
Merry Christmas. Bye.
Thank you for having us. Bye.
Christmas.